Okay, we're on a couple minutes early here. So let's just wait a minute for people to get on board here. I clicked it 1 minute early to go live. So, but I do want to welcome everybody here. We do want to do a little disclaimer that we are just here for educational purposes only, that we don't treat or diagnose any diseases. I'm excited today to welcome my husband on board. We have been in the health and wellness business for a long time, as well as in conventional medicine as a pharmacist and as an RN. And we used to own a pharmacy health food store in North Branch, Michigan. And now we're semi-retired and enjoying ourselves in Florida and looking forward to going up to Michigan for the summer. And it's great to have an opportunity to share this information with you that we have today. So Mike, we're pretty close to the time. Do you have any other introductory comments you'd like to make?
No, just thank you, Pam. Just thank you, Pam, for letting me take part in your program. It's going to be a pleasure. I appreciate that.
Yeah.
And, I'll try and talk fast so that we can get through this in 10 minutes. But
I know that's a challenge for you, dear.
It is, yes.
He's a peaceful, take it easy kind of guy.
You just give me the signal to go when you're ready.
Nope, you go ahead, honey. It's noon now, so we're talking about drug nutrient depletion with my husband, Mike Sadler, the pharmacist. Go ahead, honey.
Okay. As Pam said, we're going to talk about drug nutrient depletion, and this is a topic that is kind of not really known a lot. I mean, doctors don't talk about it much, but let's see what we can do to give you some type of information that you can take back to your doctor and maybe have some questions and so forth. Let's just start with a couple of definitions. The first one is a drug. A drug is a substance that directly or indirectly interferes with normal body functions and biochemical actions and reactions. A nutrient is a substance that people need to maintain normal body maintenance as it is in actions or reactions in normal body functions.
That's fabulous, Mike. I had never looked at those definitions before to really realize that that was the definition of a drug, that it interferes with normal reactions and that nutrients help. So that's beautiful right there.
That's how drugs work, because the body sometimes knows what it wants to do, but the outcome isn't necessarily what we would like. And so when you interfere with that particular action, it makes it better for us as patients, but it may have long-term effects as far as the actual health of the body is concerned. So we've gone through that, and so let's start with a couple of drug nutrient depletions here. The first one we're going to talk about is pretty common. It's everybody knows the purple pill, or Prilosec, omeprazole is a generic name, or Prevacid, Pepcid, Tagmet, Zantac. And the nutrients that these drugs deplete primarily through inhibiting acid, which we need to help nutrients be absorbed. But that's vitamin B12, folic acid, vitamin D, calcium, iron, and zinc. And that is quite a cocktail of very important nutrients at the bottom that these drugs are depleting, and over long term can produce some very important disease states in the body, such as diabetes and gastrointestinal issues and that type of thing. The second one we're going to take a look at is antibiotics. Okay, now antibiotics are designed to kill bacteria, but of course in our bodies we can have bad bacteria, which is what we're trying to get rid of, but also we can also have good bacteria, which we don't want to get rid of, beneficial bacteria. And these bacteria are instrumental in producing and regulating hormones and vitamins and so forth. And some of the things that the antibiotics will indirectly deplete are a nutrient called tryptophan. Tryptophan is a precursor to serotonin and also a precursor to melatonin. And one of the biggest problems we have in this country is depression and sleep disorders. Also, the antibiotics, through killing the good bacteria, will deplete B vitamins and also will cause disruption in hormones. So this is the gut is a very important thing to take care of.
Mhm.
And the antibiotics, while they produce a good end result, can have catastrophic results a couple years down the road.
Right, yeah. And when you look at the immune system, which is what we're doing all these couple weeks, you're looking at the fact that a lot of that comes from your gut, and so your antibiotics are really affecting that. So you really have to take some actions to rectify that. I mean, antibiotics save lives, but you need to be wise, educated.
The next one we're going to cover is some anti-diabetic drugs. Those folks with type 2 diabetes, they can deplete coenzyme Q10, an important nutrient for energy, cellular energy, as well as vitamin B12. Some anti-inflammatories, such as the over-the-counter pain medications like aspirin, Aleve, Motrin, and then cortisol or cortisone type products on prescription for inflammation. Vitamin C, vitamin D, folic acid, calcium, magnesium, potassium, selenium, and zinc. These things can all be depleted with the use of these drugs, and that's not a good thing. Cholesterol-lowering drugs like the Zocor, Lipitor, Simvastatin, atorvastatin for generics. They're designed to lower cholesterol. But if you know anything about cholesterol, you know that's a very important molecule in the body. It produces vitamin D through cholesterol and also your hormones for regulation of body, your sex hormones. Cholesterol's the mother hormone maker. So when you deplete cholesterol, you're really affecting your body's ability to respond to inflammation and repair. Also, coenzyme Q10 is another one we mentioned above for energy. So let's go down to hormone therapy, and this includes oral contraceptives. And this I get particularly perturbed about, not the oral contraceptives, the main purpose of them, but that they do deplete vitamins, vitamin B2, vitamin B6, vitamin B12, folic acid, vitamin C, magnesium, and zinc. And women who are in the reproductive years would think, well, I'm on a birth control pill, let's just stop that and let's have a family. Well, that's all well and good and works, but you don't think, the doctor doesn't think about having a healthy body to have a healthy pregnancy. And one of the things I see in the pharmacy quite often is sick mothers and sick parents. It goes the same for the male too, as well as the female. They have to be in good health to have a good pregnancy. They come to pharmacies with sick children, and we see that all the time, and it's not something that I'm real happy about. But so if you know anybody that's in the reproductive years and starting a family, before they do that, have them go on a nutritional program. I think
Right.
that's really important.
And it has to, I did maternal child health in the field. I'm an RN, and I did a lot of maternal child health. And one of the things that I would tell the moms was that antibiotics will often stop the contraceptives from working. And so people would get pregnant because they weren't on an antibiotic. And then they're maybe on a contraceptive at the same time that's depleting their B vitamins, which are so important for neurological function. People oftentimes don't even know they're pregnant when that baby's nervous system is forming. And so we can really harm our children with this combination of antibiotics and contraceptives if they're not taking, an activated B is so important because many of us do not, I'm one of them, that do not convert B vitamins well to the active form, and that's where we need the activated methylated B vitamins. So yeah, we're both kind of, this is our thing, we want our babies and our grandbabies to be healthy. So all right, I'll stop again, Mike. You've got a couple minutes left, so.
Okay, here's an important point. the body doesn't consider medications as helpful. We do, but the body does not. They only consider them as a toxin that needs to be eliminated, and this involves liver, kidneys, and lots of nutrients. Your detoxification system is part of the immune system, okay? So what are some things you can do to reduce your risk of nutrient depletion? You could look up all your medications. These are, there's books, there's internet information. You can look at those medications to find out what nutrients to supplement with. I think that's not quite the way to go because we're dealing with your immune system here. A better way is develop a comprehensive supplement program and lifestyle program with quality supplements, well-absorbed supplements, as Pam was talking about, more exercise, better sleep, quality food. All this helps to restore nutrients as well as build up your immune system. Okay, and we would really suggest this type of program rather than just try and hit it with a specific nutrient here or there, because that's not going to work. That's the medical way of doing things.
Right.
And it's not what the body needs.
Well, and
I'm just going to list a couple books here, but you can look those up on your drug nutrient depletions. And
yeah, and if anybody, we've got a form that goes over a little bit. If anybody wants that form, just get a hold of us. We're on that Health Leaders, LLC page that we're live streaming to right now, as well as doing this Zoom. So if you want to comment below, or we'll just upload that to that page so that it's available for people to access. That'll give you kind of the bare bones thing of the nutrient drug depletions. And Ross Pelton has written some books about that as well. Did you have anything else, Mike?
Yes, but I forgot what it was.
Okay. Well, I want to, I want to point out too that the over-the-counter vitamins are not well absorbed. They don't break down well. They're not. They only have to have 50% of what they say on the label in them. And so those are, you've got feed grade that goes to animals, you've got food grade, which are your OTC vitamins, and then you have nutraceuticals. And the nutraceuticals will have over 90% of what's in there. And Mike and I actually have a line of nutraceuticals, and many people that are on here may very well, if somebody invited you on here to a watch party or whatever, get with that person and talk about the absorbable nutraceuticals that we have, because we actually have some isotonic formulations that are very absorbable. So this is really, really important information.
I remember what I had to say, Pam.
Okay.
Be sure, if you want to get off your drugs, your medications, and so forth, be sure and work that out with your doctor. He can run some tests. You can check your vitamin D level and your B vitamin levels and this and that, and get with one of our unfranchised owners, and they can also point you in the right direction. But be sure and go through your doctor and work with your doctor, and I'm sure they're more than happy to get you off your medications if it's feasible.
Right. And we do also take wellness programs to health professionals. We've got systemized approaches, and we've got research studies that doctors love to see. So anybody in business with us just loves to share that information and help us change health professional practices, one practice at a time too. So everybody have a great afternoon. I hope you enjoy your lunch today. Bye-bye.
Bye.